Let's talk about poop! If you've ever worried about your bowel habit, you might have heard about irritable bowel syndrome. This is a topic that I see a lot in general practice, as it affects so many people. In this video, I'll explain exactly what it is, and also clear up some misconceptions about it. So let's find out a bit more. Hi and welcome back to the channel. In this series, I'll talk you through some common medical conditions, how to recognize the symptoms, what steps you can take to manage them, and when you need to see a doctor. This friendly dinosaur is also going to help me describe some of these conditions. I don't really know why, but the PR team seems to think it's a great idea, so here we are. So, what is IBS? Well, as the name suggests, it's when the bowel is a bit more irritable or sensitive. It's also pretty common. It affects about 1 in 5 people in the UK. With IBS, there's a problem with the function of the bowel. There aren't any damaged cells causing the symptoms, but the bowel is misbehaving. This is different to other bowel diseases, because when we look at the cells under a microscope, everything looks normal. Whereas in other bowel conditions, we can see the inflammation or the damage to the bowel cells. It's also important to know that IBS is not the same as an allergy to a type of food, which is when the body develops a severe immune reaction. We don't fully understand why IBS occurs, and why it seems to affect some people more than others. Unfortunately, we also don't have a cure for this, or any permanent way to fix it. However, most people find that by recognizing their triggers for IBS, or by taking certain medications to control their symptoms, they can manage their IBS more effectively. The most common symptoms include abdominal pain, bloating, and a change in stools. The pain can occur in different parts of the abdomen, and it's usually described as cramping or spasms. It can vary in severity and can come and go. Sometimes this pain can also be relieved by opening the bowels. Bloating of the tummy can also be very common, along with the need to pass wind more often. You'll also experience a change in stools. Some people will have bouts of diarrhea, some will tend to be more constipated, and some may have a combination of both. When you're opening your bowels, some people experience a mucus along with the stool. There can also be a sensation that you haven't properly emptied the bowels, even after you've been. Some people also have an urgency to go to the toilet without much warning. However, there are a few symptoms that we wouldn't typically expect with IBS. So, if you develop a change in your bowel habit that's different from your normal, or if you have weight loss, severe diarrhea going several times per day, or passing blood with your stools, it's important that you speak to your doctor. The tricky thing for IBS is that there isn't a single test that we can do to confirm this. For this reason, we refer to it as a diagnosis of exclusion. This means that we might arrange tests to rule out other conditions, and if those come back normal and your symptoms fit with a typical picture of IBS, we can make this clinical diagnosis. If we do need to arrange other tests to rule out the other causes, this usually includes a blood test and sometimes a stool sample. Many people with only mild symptoms may not require any treatment. However, we broadly think of managing this with changes to lifestyle or food and medication. Lifestyle factors such as taking part in regular exercise is known to ease some of the symptoms. Managing stress can be another useful approach, whether that's with relaxation techniques or talking therapies, or in some cases medication. One thing that you could do before seeing a doctor would be to keep a food diary, and by this I mean keep a track of what foods that you eat, and if any of these trigger your symptoms. Sometimes that's a really easy way to pick up which particular foods your gut is sensitive to. We know that food can be one of the triggers for IBS, so it might be useful to adapt your diet to limit these types of foods. Everyone responds differently to different foods, so there isn't any one-size-fits-all approach, but I'll put a link in the description below with further information on what changes to your diet may improve your symptoms. Sometimes an elimination diet can also be helpful, such as the low FODMAP diet, but this should generally be tried with the assistance of a dietitian. Remember, we can't cure IBS, so the aim of medication is to control the symptoms a bit better, to give you a better quality of life. Medications that reduce the spasm of the bowel can be helpful to manage the bloating and cramping symptoms. Examples of this include Buscopan or peppermint oil, both of which are available over the counter, which means you don't need a prescription. If you're someone that struggles with constipation most of the time, it could be useful for you to take a laxative, and you can get these over the counter if you speak to a pharmacist. On the other hand, if you struggle with diarrhea, you might find it useful to use a tablet such as Imodium to slow down your bowels. I hope this has cleared up some of the symptoms of IBS, and if you feel that you might have this or are concerned about your symptoms in any way, it's worth speaking to your doctor. And remember to have a look at the links below for more information. And that's pretty much it for today. So remember to hit like and subscribe if you found this video helpful, and let me know in the comments if there's any other conditions that you'd like me to cover in future. And until next time, see ya!